Right, Erica, public health experts tell me it's still unclear how effective these types of quarantines are, and we're learning that enforcement here will look much different than it does in some other states.
It's just a signal for everyone to be vigilant.
Dr. Kelly Michelson, director of Northwestern University's Center for Bioethics and Medical Humanities, says she wasn't surprised by the mandatory 14-day quarantine announced Thursday night. But she says right now the science behind it is not definitive.
But I think we need more data about whether or not these kinds of travel bans can be effective, and if they are effective, what is the right limit?
Chicago's Department of Public Health Commissioner.
We cannot risk going backwards.
Issued an emergency travel order directing travelers entering or returning to Chicago from these 15 states to quarantine for 14 days. Why these states? They have a case rate greater than 15 new COVID-19 cases per 100,000 residents.
They're equivalent to what our numbers look like in late May.
It's more lenient than the quarantine policy for New York, New Jersey, and Connecticut, which are working off a list of states with a 10% positivity rate. And NYC Mayor Bill de Blasio seems serious about enforcement.
We'd like the Port Authority police, working with the airlines to get those names and share them with the city.
But Dr. Arwady says Chicago won't be taking the same aggressive approach.
We do not have a plan to, for example, look for out-of-state license plates and pull people over. We do not have a plan to create a list of individuals who are traveling and try to track them down. Our goal is, first of all, to get this message out strongly. That's really the most important thing.
Dr. Michelson says the jury's out on how well it will work, in part because she says the limited data they do have is based on computer models.
I think really what we need is more data about this. We need more science in this area to understand whether these kinds of limits are effective, and if they are effective, what's the best way to implement them.
So what happens if you're caught breaking that quarantine? Here in Chicago, you could face fines of $100 to $500 a day, up to $7,000. By comparison, in New York, the penalty is up to $10,000.
So, Megan, there are 15 states currently on that list. What if there are surges in other states? Will the doctor add those states to the list?
Right, so Dr. Arwady said they're going to be reviewing it every Tuesday starting on July 14th. So if there are states that meet that case threshold, they could be added. But by the same token, if there are states that get those infections under control, they could be taken off. Reporting live, Megan Hickey, CBS 2 Investigators.
All right, Megan, thank you.